First I was in a bit of a disbelief, like I wasn't, you feel a bit numb and a bit confused, a bit angry, you grieve, like you've lost the child that you thought you're going to have, because you don't know what your outcome's sort of going to be. It's quite overwhelming.
She had an issue going to the toilet, so she went to see a GP and they said it was a gluten intolerance and referred her to a specialist, made an appointment for about 2 months' time. I think that was on like a Monday. By the Wednesday or Thursday she had rectal bleeding, and we took her, my wife took her into PMH during the night, and after a few tests then they realised there was more to it. Initially they weren't sure if it was bowel cancer that had spread to her ovaries or ovarian cancer that had spread to her bowel.
Hunter's cancer is genetic, and he's got a cancer called bilateral retinoblastoma, which is, in essence, it's cancer of his retinas in both his eyes. And his dad actually had an eye removed because of the disease when he was 1 year old. So we were very aware that he had a very high possibility of getting this. So we were looking out for it, and my daughter was checking him all the time to see if he actually was going to get it. The healthcare nurse and the GP that they went to would check him all the time, but they never picked it up. He didn't really seem that interested.
The second doctor, he did an x-ray from the hips down and said, oh, there might be something suspicious in her right leg. And while we're there for the 3 hours, she went from not being able to move her legs to not being able to sit. And I said, oh, she now can't sit. Are you sure this isn't spinal? And he pretty much laughed at me.
He just said it was muscle. And I said, no, it's not. And he said, yeah. And in the end, we ended up getting him to do an ultrasound because I didn't think it was normal. You know your child. So we had the ultrasound. The ultrasound lady actually came out and spoke to me and said, look, it's just a fatty mass. And I knew that that report would go to the doctor and the doctor wouldn't do anything.
The second doctor put her right leg in a full cast from hip to toe, and it wasn't until 2 days later when she was a complete ragdoll and I took her to PMH and they observed her, and then the following day they did some tests, and so at PMH they told us that she had neuroblastoma.
And it wasn't until the third time we took him back again when my wife insisted that they would do more tests or something was clearly not right, was when we were given the news that, yeah, well, they didn't give us the news, they put us in an ambulance and sent us straight to PMH, where we were then told what it was.
On one level, I'm kind of, I don't know, naive, old school, however you want to call it. I was like, you're the doctors, you're the experts, I have to trust you.
We just want parents to be listened to, and if you're a parent and you think there's something wrong, you just keep asking the questions and you keep going until you are happy with the outcome. If I had listened to the first doctor who had said, oh, it's just behavioural, she doesn't want to move her legs today, which a nearly 8-month-old doesn't really have the comprehension to do that, I would have taken her home and within 48 hours she probably would have been dead.
I go to a doctor because I trust them to know what they're doing. The doctors didn't know. They all assumed that it was one thing and it was nowhere near it. You know, they need to learn. They need to listen. As a parent or even as a child, you know what's not normal. Listen, we're not idiots. But also learn. Doctors, all of those people should be continuing their education too. You shouldn't become someone and then that's it. You know, look at other things as well. If you don't understand it, don't just leave it and blow it off. Question it, look into it.
The fact that we were turned away 3 times by a hospital is, you know, I don't believe our GP could have done it. I don't blame him in any way because there was no other symptoms. A few bruises, some kids do bruise and they hang around maybe. In hindsight, if this ever happened again to another child, I'd be pushing to get these tests straight away. But it's quite worrying to know that he had blood tests done on 2 occasions and it was only the 3rd time. Why? What was different? Why didn't it show up before?
From what I've actually seen is the communication between parents and staff is one big area that needs improving. You know, when you're an inpatient, the doctors come around, they do their rounds, you know, they come and take bloods, the staff are in and out, they're discussing between themselves, but they don't actually communicate that to the parent about the patient. So you're unsure, and unless you're asking all the time, what's going on, what are my child's results, you know, what is going to happen next, they don't actually communicate that with you.
I think when we walked into and they didn't know what was going on, we were frustrated. I think you're in an emotional roller coaster as well the whole time. It's 1 minute you're upset about the whole situation. There were times when other bits where I don't remember how I felt, but then you do have, there's times of, like, I guess happiness, and that as well has come from the whole thing. But I think frustration was huge with them not knowing what. So, and you get frustrated because they don't know. I feel like a lot of the time it's a guess. It's an educated guess, but they're guessing it, or we're going to try this, or we could try that. Or even with Zoe's, it was a couple of different, for surgery, there was a couple of different options, and they're like, well, we're going to use this surgery, or we might try that surgery, and that's, you felt like you're left hanging. And sometimes it's easier just to, this is what we're going to do, and this is it, and that's it. Well, that's the type of person I am, I guess, but yeah, it was hard to walk away sometimes not knowing what was going to happen next.
I think that when doctors have patients around like 17, 18, instead of speaking more to the parents, they should speak to you as they're speaking to the parents. So it's like you're making the decisions. I guess the fact that like Richard Carey-Smith, the surgeon, he wasn't always negative about it. Like he was telling me bad stuff, but he had a way of saying it that didn't make it seem so bad.
There's a frustration that cancer parents must feel because it consumes you. You try not to let it, but it does consume you. You are thinking ahead to the next thing. We've got to do these scans. We've got to, you know, is that going to be all right? Or, you know, another appointment.
Another thing that I've actually found is communication between departments. There's a big problem there. You know, MRIs are booked, you go in for the MRI, and between the ward and the actual MRI unit, they've actually got the dates wrong, or they can't tell you the correct date, or they're not sure what the correct dates are. So I think communication between the actual ward and the different departments is also needs improving.
Your relationship changes in the fact that you have different ideas of your life. So before her being diagnosed, you know, you guys, I might have been on the same part, and I'm not saying I'm not on the same part with my husband now, but you know, when a child's got cancer, you all of a sudden you change your point of view on life, and maybe your partner doesn't always change their point of view in the same way as you, so you almost have to get to know your partner again and what's important in life, because that changes after your child's gone through cancer.
It's when I think about my boys, it's the hardest. My wife and I have, obviously, we're still together, which is amazing because I've seen others that aren't. But the boys, that's hard. They've lost. Sorry, I just can't get it out. Both of them, I mean, they had massive support from their school, which is amazing. But, you know, an 8-year-old, 7-year-old at the time, trying to understand that, you know, he knew his brother was sick, but probably didn't realise the severity. And to tell him he's gone, the hardest thing I've done.
I know I've consciously pulled back from a lot of interaction with people who aren't in my immediate sort of circle of friends or family, just as a self-preservation thing as well, and I suppose so that I don't get upset by something that somebody doesn't mean to, you know, set me off and do my nut and, you know, to grit my teeth and think, oh, you know what, 12 months ago you might have been worrying about enrolling your kid in dancing lessons and swimming lessons and juggling work and dental appointments, and that's okay, that's people's biggest stress. And as I said, I'd happily have that be my biggest stress again. So if you're not there, you're less likely to say something inappropriate.
We're looking at Zoe and you're trying to raise her as a normal person, as a normal child, but then knowing that her life is going to be very different to most people's, or what most people expect their life is going to be like, because she does have it hanging over her head that she's, you know, at the age of 14, she went through cancer treatment. She's had both her ovaries removed. She's on hormone replacement therapy. She has, and all the side effects that come along with cancer treatment and losing the ovaries and part of your bowel and all those things. And I guess, but you can't treat her. Also, I feel you can't treat her too different, because then who knows what will happen. Like if we pamper her too much, then she becomes not the person who's going to go out and live a happy life, and she's going to feel like sometimes she'll lock herself in a room and do nothing, and the whole woe is me attitude. So I guess we're trying to raise her as much as to the best that we can as a normal person within her limitations. She has had stuff where she, having a tumour about the size of a football, I think it was, removed from her stomach, so she lost a lot of core strength. She plays a lot of softball and used to play a lot of netball, and then having lost that core strength, struggles to be at the same level that she expects herself to be at, despite the fact that everything she's gone through.
My friends were really good. They were always there for me and always came and visited if I wanted them to, and they caught up with me out of the hospital all the time, brought me stuff to do, and they tried to understand as much as they could and tried to be there for me. At first, missing out on school was a bit weird, but after I'd missed out on lots, I didn't want to go back because I didn't know what people would think of me. But after being forced to go back, it was kind of easier, and the school was really good with everything. They gave me extra time to do assignments and tests and stuff if I needed, and they just said, come when you feel like coming. And I dropped out of my ATAR subjects and just did general, so that made it a lot easier.
I go, as much as I wouldn't wish this experience on anybody, not even my worst enemy, you would not want anyone to go through this, but sometimes you wish some people could learn the lessons or the values from it. You just sort of realise how precious life is, and to live each day to the fullest and just be grateful for what you've got, not what you don't have.
A couple of times she'd said, oh, my legs are sore, but you know, it's an 8-year-old who's active. Oh, give it a rub, you'll be fine. I would probably say from that point of view, given the kind of cancer we had, you know, if a kid complains more than usual about leg pain, arm pain, something like that, at the very least insist on an x-ray, and you might be a few $100 out of pocket and you might feel a bit of a fool, but it could save a lot of grief in the long run if you get it early.
I found it really hard to find a GP that I felt comfortable with. You've gone from 24/7 care with a doctor and 500 nurses around you and online support to let her go off and just see your GP if she's not feeling well. And I'm like,
You're sort of left in the dark. You don't. You've finished and that's it, you're done.
We walked out of that room and we thought, what's actually just happened? You know, what do we do from here? Where do we go from here? If he gets sick, we would phone 3B. You know, now if he gets sick, what do we do?
it is hard. Everyone thinks that once your treatment's over, it's all like, yay, she's good, she's fantastic, she's cured. But, and that's especially from outsiders, like friends, you know, like, oh, you know, she's looking so good. And yes, she is looking fantastic and she is doing well. But the fear that is inside of us every single day that, you know, every 3 months we have to go back and do tests.
I'm just thinking back to when Sophie was in treatment and she had to be in a wheelchair all the time because she couldn't be weight bearing on her leg, and then post-surgery, etc., etc., and obviously, you know, bald and skinny, and then with the feeding tube in. Don't stare, but smile. And look, don't be afraid to ask. Don't be afraid to ask, you know, what's happened, or what kind of cancer is it. You know, most parents are happy to have the opportunity to, you know, spread awareness and create awareness, and as I just said before, suggest what you might want to be looking out for yourself. It doesn't mean that every bump or knock is cancer, but, you know, if you check it out and it's not, well, fantastic. It's okay not to know what to say, and you can just say, I'm really sorry this is happening to you, and that's enough too. That's enough too.